first welcome everyone. Good afternoon. My name is Ruchira, and on behalf of National Institute of Rural Development and Panchayati Raj in New Delhi branch, I extend a warm welcome to all the dignitaries who have joined here today for our second webinar of Evidence-Based Policy and Action Roundtable. After our last roundtable discussion on poverty reduction, we shall engage today on the second SDG of our virtual panel discussion on Towards Zero Hunger, Evidence and Policy Recommendations. It is my great pleasure to welcome our panelists, Professor Vikas Rawal from Center for Economic Studies and Planning, Jawaharlal Nehru University, Dr. Purnima Menon from International Food Policy Research Institute in India branch, Dr. Giacomo Zanello from University of Reading, UK, and our Honorable Chair of the webinar and our Director General in IRDPR, Dr. G. Narendra Kumar. I would also like to extend welcome to the invited rural development functionaries, the guests who have joined here today, and also the esteemed colleagues and beloved students. For those who have just joined these sessions, to give you a background, this initiative intends to facilitate cross-learning, sharing of evidence, and we want to help plan actionable research and develop strong monitoring framework. We have started the discussion series with a webinar on the first Sustainable Development Goal, which is reduction of poverty, where we had Dr. Sabina Erkide discussing her research on multidimensional poverty index. And today we shall discuss the second Sustainable Development Goal, which is zero hunger. The gravity and relevance of today's topic is beyond debate. India has been grappling with widespread malnourishment and undernutrition, and especially after the pandemic, the situation has worsened. India's malnutrition was already bad amongst its women and children, and now the nutrition and food emergency has also worsened. We were ranking 100 and 119 countries in global hunger index, and the pandemic and the subsequent lockdown has worsened that part. Like poverty and well-being, the challenges for food and nutrition are also multidimensional, and they include a range of issues starting from availability, access, utilization, long-term sustainability, policy convergence, and sectoral coordination, and so on. To have a multidimensional and multi-sectoral discussion on the subject, we will have three experts talk about it today in their subsequent talk and panel discussion. But before I invite our experts, we would like to hear from our Director General, and I would request Dr. G. Narendra Kumar to deliver a welcome address for those present here. Sir, this mic is now yours.
Thank you very much, Ruchira, and a warm welcome to all the experts and participants to this webinar on evidence-based policy. What I'd like to do now is to try and bridge the gap between the practice and the academic discourse on zero hunger and some of the initiatives that are taken in India towards the zero hunger. Doing so, I present the practitioner's perspective, having worked in the senior administrative service of the country for over 30 years. So, as many of us would be aware, that India is ranked 94th among 107 countries on the global hunger index. But we've been showing a steady improvement from 38.9 in 2000 to 27.2 in 2020, which is a substantial improvement over this period of 20 years. Also to note are that the various features which constitute the rank under the global hunger index, that is undernutrition, undernourishment, wasting, stunting, and child mortality. All of them are addressed very substantially by the Indian program of the Integrated Child Development Scheme, especially the Supplementary Nutrition Program. Also, of course, the child nutrition mortality is addressed under the ICDS. So, one very significant improvement of which I have been part of, the supplementary nutrition component of the Integrated Child Development Scheme, was the hot cooked meal supply to the expectant, lactating mothers and for the young children. So this hot cooked meal supply through the self-help groups, NGOs and so on has been a tremendous help in improving the nutrition status of the mothers and the children. However, there was a small problem here, which is the supplementation, in the sense that the micronutrient supply in the meals was not really being ensured. And some measures need to be taken to ensure that the micronutrient supply is also enhanced. I have been part of this initiative in Delhi, where we had reconfigured the system. Many of us may not be aware that in around 2004-5, this movement was started that look, a lot of the food grains that were being supplied, the food material which was being supplied in the name of ready-to-eat food, is just being thrown away by the beneficiaries because they were of low quality, they were sort of fungus infested, and so on and so forth. Then the Supreme Court also stepped in. The states were asked to make commitments that the food supply will be will have good quality, and that ready-to-eat food will be substituted with the hot-cooked meals. So hot-cooked meals then were supplied through the self-help groups, which is again a large initiative in the sense that every village we have to supply the meals on an ongoing basis, on a daily basis. So in Delhi, we engaged the non-governmental organizations, non-profit organizations to do this supply. And again, the supply chain is also the logistical challenge is a huge challenge. The supplying so many villages, so many beneficiaries, Anganwadis in different parts of the country is a huge challenge, which we've been able to get over, and we've been able to ensure that the food is supplied in time to all the Anganwadi centers. Hot cooked meals are supplied to all the Anganwadi centers and the beneficiaries in this. And personally, it was a matter of great satisfaction, especially in Delhi, that every day we were able to feed about 10 lakh beneficiaries under the hot cooked meal schemes, part of the ICDS. Similarly, a lot of initiatives were also taken up in different states of the country, and the hunger index, I would assume, should have been going down with that initiative very substantially. But what is a little disheartening is that we are going back on it in many states, that the focus of the Supreme Court and other regulatory agencies is not so much on the hot cooked meals, and people are now going back to the ready to eat food in different names to say that, look, we're having therapeutic food and so on and so forth. So those foods, again, there's a challenge of the beneficiaries consuming those food articles. Quite often there are challenges to say that, look, the beneficiaries don't find the food tasty, and they again start discarding such issues. Instead, the focus ought to be on supplementation of the hot cooked meals with, let us say, millets and so on and so forth. So that should be the focus as has been in the past, and I think we will continue to steadily improve and move our rank up on the global hunger index. In the global hunger index, one of the key things is the child mortality rate. The child mortality rate doesn't come essentially from the hunger part of it, also because of the healthcare facilities which may be available, not available in the rural areas and remote areas of the country. So that also we simultaneously have to take initiatives to improve the healthcare facilities in the rural areas, which will lead to reduction in the global hunger index. So if we discount the child mortality feature of the global hunger index, I suppose India must be much better on the index. That's something that needs to be taken care of. So other issue was that about the need for supplementation itself. So you have to supplement the food to the ultra poor, those who are not able to get any food at all, or they just don't get the required kind of food. So we provide a dietary supplementation. But the country as a whole, India as a whole, has done very well in terms of the food grain production from 1965, when it was a net food grains importer, to the status of a food grains exporter. Now we are among the, I think, third largest exporter of food grains in the world. So there's no shortage of food grains production in the country as such. Issues are more with the distribution of the food grains and with the proper quality of the food grains. So the quality is where the issue is that, look, our dietary habits in the country have changed very substantially. From being a major consumer of millets in the dryland areas of the country, we are now switched to consuming rice and wheat in large measure. And the millets are rich with micronutrients, with calcium, with, let's say, ragi has about 20 times calcium compared to rice and so on. But we have moved away from those. And even in terms of the nutrition, for instance, if you take jawar, that has got a substantial amount of fat content, which again adds to the nutrition quotient of the individual. So we moved away from these foods towards the lighter cereals such as rice and wheat. So this move has proved counterproductive, I think, for the population as a whole. So we need to find ways of getting back and reconnecting with our earlier eating habits of consuming millets and so on. So that's an issue that needs to be tackled on a large scale. How do we change the dietary habits of people towards the earlier systems of millets? The other issue is with the distributional problems. As I was mentioning, the problem is not that we don't have enough food grains production. We have enough food grains production. Distribution is the problem. People may not be getting the food grains where they require, or those who really require them may not be getting the food grains in sufficient quantities. And for that, the PDS system has been put in, the National Food Security Act and the system has been put in. But there are flaws in the design of the public distribution system and the National Food Security Act. So as a practitioner, we have seen quite often that in some states, in earlier decades in particular, the number of ration cards, the number of public distribution system beneficiaries was much higher than the population of the entire state or districts, which is completely points to the fact that there are a number of fictitious entries, number of fictitious card holders, and so on and so forth. So there are people who are getting benefits at the cost of those who really deserve those benefits. So devising systems for weeding out those who don't deserve the benefits, passing on the benefits, food benefits to those who really deserve is a key challenge in the public distribution system. Added to this, now we have the National Food Security Act. Under this, now we're supplying food to about 38% of the below poverty line beneficiaries, but they're supplied at a very, very low cost, 2 rupees for wheat and 3 rupees for rice, which is a very pittance of the rate of the market rates. And that itself causes problems to the entire system, in the sense that the food grain supply is so highly subsidized, it makes way for a lot of pilferages, lot of leakages, and leakages driven very substantially by the transporters, by the fair price shop owners, and so on and so forth in the private sector. If to get a ringside view of the entire system, public distribution system, the way it is transported, people often say that, look, it's the government officials who are corrupt, who are in cahoots with the private sector, and so on and so forth. But if we really look at it, there are huge transport mafias which are operating. So if you ask someone to go to the fair price, to the FCI godowns and check what is being loaded on the FCI godowns, the transport mafia, the labor mafia is so strong that they would never allow such inspections and checking to be done. So such is the strength of the mafias, I would say, in the food distribution system, public distribution system. So this kind of mafias have to be broken for the public distribution system to be effective. And added to this is the fair price shop owners. They just go along with the mafias. They go along with the beneficiaries who do not exist, and these create problems in passing on benefits to those who do not really deserve the benefits. So the non-availability of food grains has come into focus with COVID, and many people who could afford food grains also could not get access to this, and therefore the Supreme Court also has stepped in. Government also has stepped in to say now we must make available food grains to everyone and have portability of the public distribution system through the one ration card, one nation system, and by providing for point of service IT enabled systems in all the fair price shops. And with that, I hope the system would improve, that we can ensure that at least the proper beneficiaries at the fair price shop point get the benefits. So that can be issued. So I think these are some of the practical issues that I wanted to place before this forum. And the future is not very bleak. We have got enough programs to deal with the hunger problems of the country. And hunger problems broadly, I see, are not those of means, are not those of non-availability, but those of management. So if we effectively manage the system in the country, I think very substantially we can reduce the hunger index and the hunger problem very substantially in the country. Thank you very much.
Thank you, sir. Thank you so much for setting the context and such an expansive welcome address touching upon all the issues. We would now move on to the main webinar where we have three panelists with us. I think Professor Rawal has now joined and he can also unmute himself. Professor Rawal, I'm audible to you. Professor Vikas Rawal is a Professor of Economics at Center for Economic Studies and Planning at Jawaharlal Nehru University, New Delhi. He will be talking about the intersections of agrarian and food policy in India. His main research interests are in the area of food and agriculture. His research encompasses detailed field-based studies across many states of India, large-scale macro-level studies for India, as well as work that looks at global issues in the area of food and agriculture. Apart from having visited and lectured at many universities, he has also been a senior consultant at the FAO for governance of agriculture, food security, nutrition, and rural development. He is widely published. His recent work includes a co-authored book titled Ending Malnutrition from Commitment to Action and two co-edited books on the global economy of pulses and When Governments Fail, a Pandemic and Its Aftermath. Welcome, Professor Rawal, and the stage is now yours. Over to you.
Thank you, Ruchira. I'm sorry for this last minute hiccup. I don't know why this happened, but and I don't know. I'm going to give a slightly gloomy picture to the audience, so my apologies for that as well. Let me first start by talking about the global situation in respect of hunger, food insecurity, and malnutrition. And as I do that, I'll also talk about Indian situation and finally come to the challenges that we have in India. Now, recent years have seen an increase in the number of chronically hungry people in the world. There's a probability that in 2030 we are going to have a world in which a large number of world's population would still be dealing with hunger, food insecurity, malnutrition, underdeveloped agriculture and food systems, and depleted natural resources. Now, if you look at the data, not only is the world not on course to achieve the SDG goal 2, in fact, the world is moving away from it. The world is moving in the opposite direction from the goal. So it's not even the case that we are slowly progressing towards the goal. We are actually moving away from the goal. The State of Food Insecurity report, which is the most important resource at the global level to track food insecurity. The 2020 report projected that even without taking into account the impact of the COVID pandemic, the world was expected to have 190 million more people facing chronic hunger in 2030 than there were in 2050. So in 2030, it was expected that the world will have 190 million more people. So leave aside, not only you were not moving towards ending hunger, you were not even moving towards reducing hunger. The hunger was actually rising. If you look at the trends, the global trends in agriculture, this comes from the latest State of Food Insecurity report, which is for 2030. You find that the reduction in hunger had sort of plateaued, and then and then it starts rising. Okay, there is a little bit of rise that one sees here. Things are, of course, much worse. This is prevalence of undernourishment. Prevalence of undernourishment is the most important measure of hunger. It was the MDG indicator for measuring hunger, and it is also the SDG indicator for measuring hunger. Just a little bit about what we mean by hunger. Hunger refers to a chronic inability to consume adequate quantity of food in terms of what is the minimum requirement of calories for normal healthy living for a person. Now measuring prevalence of hunger requires then to have some kind of a measure of what is requirement of calories for a person. And obviously, calorie requirements of persons vary. uh, I mean, an adult who does physical labor has a higher requirement of calories as compared to an adult who lives a sedentary life. A baby has a lower calorie requirement. A pregnant woman has a higher calorie requirement than sorry, am I audible?
Yes, sir. Now you're audible.
Sorry. Yeah, so the calorie requirements vary. So you need a measure of hunger which takes into account the distribution of requirements as it takes into account distribution of what people actually consume. So it's slightly, well, it's different from, for example, the way traditionally poverty was measured in India, where poverty measurement in India was also pegged to calorie intake. But when you have to measure hunger, the method is somewhat different because you need to take into account variation in requirements. In case of poverty measurement, we essentially use the normative benchmark to basically peg our poverty line to. It was not necessarily, you know, it was not necessarily what everybody actually needed. It was a requirement of of a certain adult with a certain profile that the poverty was benchmarked to. But when one's measuring hunger, one would like to look at requirements, basically look at calorie intake vis-a-vis calorie requirements, and that would require taking into account the variations in calorie requirements as well. Now, prevalence of undernourishment is a method that somehow allows you to do that. It essentially models requirement of calorie depending on age, depending on body mass, depending on the activity levels of people, and using that, it sort of creates a benchmark that takes into account the average calorie requirement and measures the distribution of calorie intake vis-a-vis that benchmark. Now, prevalence of undernourishment essentially is a method that allows you to do that. Now, if you look at the trends in prevalence of undernourishment, two or three important things stand out. One is that in the recent years, proportion of population in the world as a whole, and in South Asia and in India, which is facing chronic hunger, has tended to rise. The second thing is that uh, if you look at absolute number, that rise is even more substantial, obviously. Now, if you look at absolute numbers, then India has the dubious distinction of being the country with the largest number of hungry people. Obviously, it's a large country, and it's also a country with a fairly substantial prevalence of undernourishment, which means that in terms of absolute population that faces chronic hunger, India is the country with the largest numbers. In fact, the FAO estimate, I believe, is actually an underestimate for a couple of reasons. One is that FAO uses the food balance sheets, essentially the supply side data, to measure average calorie intake. And as we know, the supply side data tend to overstate calorie intake. This has been known in India since at least early 1990s, when the Lakdawala committee recommended stopping the practice of pro rata adjustment of consumption survey data to match it with supply side data. But at the international level, because of lack of regular availability of consumption data, you don't have consumption surveys every year in any country. In fact, in most countries, they're quite irregular. The only way to do it is by using supply side data. But that means that you tend to that's one reason why you would underestimate hunger. The second thing is that because of lack of data on activity levels, the way FAO measures prevalence of undernourishment, it does not take into account the distribution of different activity levels in the population. It takes into account the distribution of body mass, it takes into account the gender composition, it takes into account the age composition, but you simply don't have internationally cross-country data which would allow you to, for example, use data on occupations employment to make some, to have some measure of distribution of activity levels in the population. So in countries where you have a substantial population of workers that are engaged in physical labor, the FAO method would tend to underestimate prevalence of undernourishment. In fact, we use the NSS data to estimate prevalence of undernourishment, and essentially found that in 2011-12, 39% of India's population, a staggering 472 million people, were undernourished. If you both use the consumption surveys and use the occupational profile of the population. Okay, so India has a very large population. I mean, even by FAO's number, we are the country with the largest population of people facing chronic hunger. In reality, that number may be several times more than what FAO is estimating. And if you look at the number of persons undernourished, that number is also very, very large, and has in the recent times tended to rise. Now, these limitations of measurement of hunger. Okay, now there are several. One is, as I said, because of limitations of availability of data, the way FAO measures it, it tends to understate the problem of hunger. Two, hunger, the way it is measured is only looking at one particular aspect, chronic inability to acquire adequate calories. Only one particular aspect of food insecurity. FAO has started using a different measure, what is called prevalence of moderate and severe food insecurity, which is based on actually surveys conducted on experiences of food insecurity. What are experiences of food insecurity? These are experiences, for example, of having to miss a meal. That when a person cannot have meal because of lack of money or lack of having food, or if a person has to ration quantity of consumption because the person did not have these resources, or if person had to basically change the composition of what the person eats because the person cannot afford what is adequate and nutritious for a person to eat. So if people have faced these kinds of experiences where they have had to either modify their diet, change the quantity that they consume, or skip meals and so on. Surveys are done to collect information of this kind, and then that is used to measure the prevalence of food insecurity in a population. If you look at that measure, you find again one that the prevalence of what is called moderate and severe food insecurity, which is again another SDG indicator for monitoring SDG goal 2, shows that prevalence of food insecurity has been rising in the world, has risen very substantially. And once again, India is a country with very high levels of food insecurity. And again, in India, food insecurity has tended to rise in the recent years. Now, along with this, I would like to bring to your notice a certain shift that one sees in the global narratives on hunger and food insecurity. If you look at the recent debates, for example, debates around the food system summits that are going on, that have gone on in the recent months, you find that while ending poverty, hunger, and food insecurity are the most important pillars of the SDG agenda, and the largest number of hungry people face that situation out of sheer poverty. There is a disconcerting shift in the recent narratives around goal 2, and the problems of hunger and food insecurity are being sidelined from the core of discussions on goal 2. That shift of narrative is rather conspicuous. The adverse impact of the pandemic is being used as a cover to give up the fight to end hunger, and instead to shift the goalpost to other aspects of goal 2. So suddenly, it's food systems that have become important. Sustainability is what you talk about. You talk about food losses, food waste, much as if those are the core problems and not deprivation and poverty. So hunger, food insecurity, primarily arising out of poverty and deprivation, have uh, you know gone out of focus, and there's an attempt to shift the focus towards other issues, in particular issues that are actually challenges primarily for the first world. Now, if you look at data on prevalence of malnutrition, you again find that India is a country with very high prevalence. At the global level, look at data on stunting. Globally, you have 22%. In India, it's almost 31% of India's children are under 5 children are stunted. Look at wasting. The global rate is about less than 7%. India is 17.3%. Okay, if you look at the absolute number of children facing malnutrition, you realize that the burden of malnutrition, of the global burden, India accounts for a very, very large share. Look at stunting. Out of 150 million children facing stunting, 36 million are in India. Out of 45 million children facing wasting, 20 million are in India. Okay, so we face an extremely high burden of malnutrition. We face an extremely high. We are dealing with an extremely high share of burden of malnutrition, of hunger, and of food insecurity. So that's the situation that we have. The recent data from NFHS 5 are not particularly encouraging. We don't have all India estimates yet, but the estimates from the states for which we have show that for a large number of states, in fact, some of the key measures of malnutrition have worsened since the NFHS 4. Now, what about COVID pandemic? Now, as per the State of Food Insecurity estimates, the pandemic may have pushed an additional 165 million people into chronic hunger. As I said, Sophie, measures of hunger tend to underestimate the problem the way they are designed to. It's not really a problem. It's not a fault. They are designed to be that way. They tend to it tends to be the lower bound of what the problem is. But even that lower bound shows that an additional 161 million people may have been pushed into chronic hunger because of the pandemic. An additional 5 to 7 million children under 5 from low and middle income countries alone may be stunted. That is an additional stunting in 2030 due to the pandemic. The additional problem of stunting, the increase in stunting that has happened during this period may result in 2030 the world having 5 to 7 billion extra children having the problem of stunting. Now, similarly, it is estimated that the pandemic may have resulted in an additional 16 million children being affected by wasting. And it is estimated by 2030, this could be up to, this could result in an up to 2.8 million additional children being wasted in even as far as in 2030, additional children. Now, what are the global challenges that the COVID pandemic has posed in terms of the world dealing with the problems of hunger, food insecurity, and malnutrition? What has it meant in terms of the world making a progress towards achieving SDG goal 2? Now, the COVID-19 pandemic has made the task of ending hunger by 2030 clearly considerably more difficult. Now, that has happened in two ways. On the one hand, it has resulted in an increase in the requirement of resources for achieving goal two. On the other hand, it has created economic conditions in which mobilizing such resources will become considerably more difficult. So on one hand, the problem of hunger has increased, the problem of malnutrition has increased, and on the other hand, you have a situation where mobilizing resources for making investments, expanding food security program, expanding social protection program to deal with these problems is going to become more and more difficult. Now, that said, I believe it is a mistake to blame all our failures on the pandemic. And uh, it's important not to use it like a forest fire, in which not only the trees that were there in the forest are counted to have been burned, but also trees that were not there are blamed to have been burnt in the forest fire. Now, hunger and food insecurity were in fact rising even before the pandemic hit the world. So one needs to look at structural reasons why that was happening. And there is no reason why the world should stop making efforts to end hunger. And that my worry that really is my serious fear, that because the recent years have shown that hunger is rising, and because mobilizing real resources to help people cope with hunger are going to become more difficult, the world community is perhaps going to stop making efforts to do it. What about the situation in India? Now, the situation in India is actually rather peculiar. So, as I said, on one hand, we have very large population of people who face hunger, people who face food insecurity, and people who face malnutrition. On the other hand, we are a country with absolutely incredibly large amount of food stocks. We are today, the government today has food stocks that are historically high. It has never happened that India has had such a high stock of food. On 1st of July, India's stock of food was 120 million tons. We had more than 120 million tons of grain lying in the godowns of the government, of the Food Corporation of India. Now, this is an incredible situation. You have, on one hand, mountains of food stocks, food stocks that far exceed our buffer stock requirements, food stocks that far exceed our strategic requirements, food stocks that far exceed even the storage capacity that the government has. Now, this has happened particularly over the period of pandemic, which is even more, counter, is a strange situation. That on one hand, you have this huge burden of food insecurity, hunger, and malnutrition. On the other hand, you are facing the people are facing this economic and health crisis, and at the same time, you're sitting with large food stocks. Now, if you look at the distribution of grain through the distribution of grain, sorry, the legend of this graph is a bit messed up, but you basically have the monthly distribution of grain here under the National Food Security Act. And then at some point, when the pandemic hits, Government of India starts the Pradhan Mantri Gramin PMGKAY, Pradhan Mantri Garib Kalyan Anna Yojana. Now, under PMGKY, it was promised that the entitlement of beneficiaries of National Food Security Act will be doubled. Okay. Now, as you can see, in none of the months except in the month of May 2020, that promise is met. It has always been the case that distribution of PMGKY has been somewhat lower than what was distributed under Food Security Act. The second thing is that PMGKY is stopped basically in November 2020, and then you have several months when PMGKY is stopped, and then when the second wave hits in May, it started again. So second wave hits around the end of March, early April. April was still a month without PMGKY. It starts in May and it goes on for about 3 or 4 months after that. Now, the point to note here is the following. One is that you are sitting with 120 million tons of grain. National Food Security Act mandates that subsidized grain be provided to roughly 2/3 of the population. So 3/4 of the rural population, half of the urban population. It roughly comes to about 2/3 of the total population. And what you've done here is that you said during the period of the pandemic, the lockdown and the economic crisis that we are going through, we are going to double that entitlement. So instead of 5 kg per person, people can get 10 kg per person. Now, we found there are two problems in this. One is that there are you see the ration cards for NFSA were made in about 8 or 9 years ago, and there are many members of households, children who are born, uh, there have been marriages, women have come into the households, and all kinds of demographic changes have taken place. There are people who are not registered in the ration card. So effectively, people do not get 5 kg per member of the household. They get, even if they get 5 kg per person registered on the ration card, that normally amounts to grain being less than 5 kg per person per member of the household. The second thing is that there are obviously a fairly substantial population which is outside the network of National Food Security Act. The implementation of National Food Security Act is now about 7 or 8 years old. New ration cards have not been made, and the problem is that we are still using Census 2011 to peg the National Food Security Act's mandate. While obviously there's been an increase in population, there's been an increase in a number of households, there's been partitioning of households and all of that, and none of that has been taken into account. So you basically have a fairly large population of vulnerable households, and even among those households which have ration cards, members of households which are not covered by NFSA. Okay. Now, the way we have dealt with the COVID crisis, even though we have in fact made a substantial increase in entitlements of NFSA beneficiaries, we have not made any serious effort to cover those who are outside the network of NFSA. Now, this is actually rather problematic. I mean, there's been this talk of one ration card, one nation, one ration card scheme, which has been going on now at least for a year, since more than a year since the pandemic. But the talk of the scheme was going on since even before that. The problem is that there are obviously major technical challenges in having a scheme of that kind. But the thing is that there is no reason why, given the huge amount of food stocks that the country has, that government of India cannot simply open the stocks. Why can't we just say that during the period of the pandemic, everybody who needs grain can take grain from a ration card? What will happen? There would be some leakage. So what? And we are just sitting on huge amount of grain, and we are spending fairly large amount of resources in holding on to that grain, in preserving it, in carrying it. There is no reason why we should be doing that. In fact, India has been exporting rice, fairly substantial quantities of rice since last 1 year, uh, particularly to Southeast Asia, essentially because Indian rice prices, Indian open market prices of rice have crashed because of these huge stocks. And on one hand, farmers are having to sell their rice at very low prices. Farmers who are not covered by public procurement are having to sell their rice at very low prices. On the other hand, because the open market prices are low, India is exporting grain. Now, there is no reason why Indian people should just not be allowed to take subsidized grain. You have very large amount of food stocks. There is no reason why this should wait technical solutions. There is a simple solution to the problem, which is to just open up the godown. Just say anybody who wants to take ration can take ration. There are also other challenges that we face. I mean, it's been a year and a half since most schools are shut. The midday meal schemes are in a mess. In most states, they have not been functioning. There have been some ad hoc attempts at distributing grain. In most states they have not functioned properly. In most states, they don't exist. In some states, in a few states where they exist, they have not functioned properly, and we really don't know what has happened to nutritional status of children, particularly children from government schools, children who used to be beneficiaries of Anganwadis, what has happened to nutrition status of them because of discontinuation of midday meal and because of because the Anganwadis are not functional. Now, these are very, very serious problems. In my view, dealing with these, unlike the global challenges that we face, I don't think dealing with these challenges requires resources. Okay, in fact, given the huge amount of food stocks that we have, distributing this grain would actually relieve the fiscal burden on the government. We don't need fiscal resources to distribute this grain. The amount that we spend on preserving this grain would be saved if we distribute this grain, even if we did that for free. So, the challenge that the world faces in dealing with in progressing towards goal 2 is not the challenge that India faces. India has food grain. India has huge stocks of food grain, and there's simply no reason why we should not be distributing it. So, that's really where the core of the problem is. I would just end with one last point, that you cannot deal with a problem unless you are willing to identify it. India has stopped tracking problems like food insecurity and hunger. India has stopped tracking problems like poverty. The last estimate of poverty we have was for 2011-12. The last consumption survey that we have was for 2011-12. We don't conduct surveys of food insecurity. Surveys that are conducted on food security are not released. Surveys of consumption are not released. Okay, so I mean, how are you going to solve a problem? How are you going to solve a problem unless you first start by correctly identifying it, by properly measuring it, by properly monitoring it? That's the first step. And the second step would be to just open up these godowns, distribute this grain, and let people consume it. Okay? And then deal with more fundamental problems that lie under other aspects of malnutrition. So I will stop here and take the question.
Thank you, Professor Rawal. Thank you for this very interesting and extremely insightful presentation that you have shared with us today. Before we take questions, I think we will first listen from all our panelists. And after all the panel discussion is over, we will take combined questions so that the panelists have a range of things to ask and interact about. So without further delay, I would like to invite Dr. Menon and Professor Rawal. I'll come back to you with the questions. We will invite questions both in the chat box as well as
Sure.
we'll let you unmute and interact in person also. But now, before we go to the question answer session, we would listen from Dr. Purnima Menon. Dr. Menon, can you unmute yourself?
Yes, absolutely. I will need to share content. So,
yes, I'm
okay,
passing the presentation. Yeah. Thank you, Dr. Menon. I would like to first introduce you to our audience. For those of you who don't know Dr. Menon, she is now a senior research fellow at the New Delhi Division of International Food Policy Research Institute. Dr. Menon is a theme leader for South Asian Nutrition Program in IFPRI's Poverty, Health and Nutrition Division. Among her many experiences spanning over more than 2 decades, Dr. Menon has also been a courtesy associate professor at the Division of Nutritional Sciences at the Cornell University. In India, Dr. Menon directs Poshan. You can see it in her slide. I'll spell it out for you. It's partnerships and opportunities to strengthen and harmonize actions for nutrition in India. This is an initiative that promotes and increases the use of evidence for nutrition in India. Dr. Menon conducts implementation research on scaling up maternal and child nutrition interventions, including evaluating large-scale behavior change communications program in nutrition and health. She is also widely published. Some of her work we will collate and share with you. She has extensive research in India, Bangladesh, Ethiopia, Haiti, Vietnam, Nepal, and she invests deeply in research translation in her engagements with policy commitments. So, Dr. Menon, welcome, and the mic is now yours.
Thank you so much. I should also say I really enjoyed Professor Rawal's talk, and if there is one thing that I think, I would really like all of us to put our heads together and discuss how to solve the problem of data is something that I would really like, a very concerted discussion about, because I feel like at the end of the day, we are talking about issues such as food security and hunger with absolutely no data in front of our hands beyond, a patchwork. And this is a political issue that, will have to be sort of reconciled with. And I think researchers should and can and should do a lot about that. So thank you again, Professor Rawal, for your talk. I think it was important that you painted the picture that you did. Gloom is as important for us to reconcile with as optimism, and so I hope to strike some notes of optimism and certainly some notes of gloom in my talk today as well. What I want to offer is, to share some of the research that we've done, which offer insights on accelerating progress. And so this is the optimism part of it. And then because Ruchira had also asked me to speak a little bit about COVID-19, I want to take a little moment to share with you, how we are thinking about the impacts of COVID-19 on nutrition, and there again, what we think we are going to need to know as things unfold. But first, the optimism part of it. So I start with a recent sort of a summary of a recent set of papers that just came out in the medical journal, The Lancet, where we published the third series on maternal and child undernutrition. It's a global series, has been. The first one was published in 2008. The second series was in 2013. And I had the privilege of being part of the writing teams for both the papers that came out in 2021. One of the things we did in the paper in 2021 is actually consolidate insights on real-world evidence for successes in reducing stunting, which is one of the many manifestations of undernutrition among children, and is one of the indicators that also contributes to the Global Hunger Index. And so we consolidated insights from successes in stunting reduction from 11 countries and 4 Indian states. And what you see on the left there is a graph that, in a sense, every bar in that graph is one country, and the colors in the bars are the percentage contributions of actions in different sectors to reductions in childhood stunting for that country. And what we cover is, the green, for example, is maternal nutrition, the turquoise is food security, the dark blue is parental education, the less dark blue is wealth accumulation of households. I think what this work does sort of really exemplify, I think one of the key messages that I would like to leave us all with at the end of the day, which is that improving an outcome attributed to undernutrition, such as childhood stunting, requires more than a nutrition program. It requires actions in other sectors that really target the underlying structural drivers of malnutrition, which include poverty, water sanitation, and parental education. We found that policies, efforts, and economic growth and other such things that address these underlying drivers accounted for more than 50% of the observed reduction in stunting. And our findings in Indian states mirror these. So what I'd like to do next is actually show you some of the research on the Indian states, and most of that is also published. So if you're interested, you can go and you can also look at some of those papers. So we studied 4 states that had shown sort of above average declines in childhood stunting between 2006 and 2016. And in the research that we've done in the last 4 years, or last 3 years on those 4 states, we asked 4 research questions, and we used methods tailored to each of those research questions. So we first, wanted to understand how did the determinants of child growth change over time, and we created a data timeline using the data sets that were available for the 2 points in time for states between 2006 and 16. We wanted to ask what factors contributed to stunting decline, and to study this, we did regression decomposition analyses using these 2 rounds of data, and you'll see findings that are similar to the multi-country piece. We wanted to understand what happened in policy that actually reshaped or improved those determinants of stunting declines. We did policy review and policy analysis along with stakeholder interviews. And then we actually wanted to understand what led to those policy changes. How did change actually happen, where change happened, and not in stunting, but change in the policies that changed the determinants of stunting. So really taking the perspective that to change an outcome, you need to change the main determinants of it, the immediate and the underlying determinants, and that these changes come from a set of interventions that are delivered in the policy space, and that improvements in these interventions and programs come from decisions that are made in the policy space and in the implementation space and the broader ecosystem. So we wanted to understand this in its totality. The 4 states we studied are Chhattisgarh, Gujarat, Orissa, and Tamil Nadu. And what you see in this somewhat complex graph is 3 panels which highlight the changes in the immediate determinants of child nutrition, such as infant and young child feeding, adequacy of children's diets, and complementary feeding, etc. That's your top panel. The middle panel shows the changes in the underlying social determinants of child nutrition. So women's education, early marriage or reductions in early marriage, water sanitation, and electricity. This is what we had access to in the data. And then we looked at changes in the coverage of health and nutrition interventions. And so I think, what you see here is that some kinds of determinants changed very much in the direction that you would expect. The program, these are all program coverage interventions, this lower level, and across the board in most of the states, they literally went straight up, very substantial improvements. You see similar directional changes, but a lot of variability in the underlying social determinants. And what we found was that those sort of nitpicky immediate determinants in terms of how children are fed and children's illnesses, etc., were a little bit more varied in how things changed. When we did the regression decomposition analyses for the 4 states, again, we find that, similar to, these findings are included in the Lancet paper as well, but it's really a mix of things coming together that contributes to the totality of change and improvement that you see in something like childhood stunting. And this is broadly how it breaks down. So it was between 10 and 23% of change coming from the actual changes in interventions, the health and nutrition interventions, the antenatal care, the immunization, the food-based programs, etc. Between 11 and 30% of change coming from improvements in socioeconomic status, and in some cases, change also in sort of social environments such as village electrification, and then another third or so of the change, 20-25% of the change coming from maternal factors. We were not able to explain all the change in all the states, but broadly we were able to explain at least 2/3 of the change. Now, what we found in terms of how those program improvements actually happen was that having a common national frame for programs is very important. So having the idea of the ICDS, or the sort of broad framework for the National Rural Health Mission, or for things like the public distribution program, electricity, roads, etc., was really important. But the states where things were successful also had undertaken sort of remarkable efforts within their states to add on, to innovate, and to sort of, in a sense, top up and accelerate the kind of policy and program evolution, going beyond, in a sense, what was happening at the national level. This was really a really common feature across the different states where success was seen. And the nature of what the states did was quite different. And that's important to acknowledge. But in a sense, the fact that you see this proliferation of things happening in the states is very much a signal of the desire to make change happen and to make a set of investments happen in a range of different programs. All of these states also, by the way, had fairly strong efforts to improve food security and poverty. And that's something that, we should really not forget, because it's such a fundamental it's such a fundamental human need, and you can't really improve child malnutrition without making sure that other things in the household also work for the families who are bringing up their children. Now, how change happened, we found that a vision for change, having sort of an enabling policy environment, which included political, bureaucratic, and financial issues, and having a range of different catalysts and champions who were really sort of keeping an eye, keeping pressure, and being supportive of the government was very important. The vision that led to improvement in childhood stunting was not a vision to reduce childhood stunting in all the different states. It was very different. Reducing infant mortality was a very important driver of change in health and nutrition systems, health and ICDS in Chhattisgarh and Orissa. The political leadership and bureaucratic capabilities really had to come together. It was very interesting that in many of the states, there had been a fairly stable political parties over a 10 or 15 year period, and very capable bureaucrats who probably because of the political stability actually had quite a bit of room to innovate and bring things together for their programs. Again, as I mentioned, in all of the states, there were strong catalysts and champions and supporters and accountability holders. It was a group of people who were doing everything that needed to be done to keep pressure on the state and to support the state at the same time. So development partners who provide technical support, the media that was providing, sort of being a watchdog, highlighting situations. In Orissa, even the Human Rights Commission had to come in and created pressure environments. But we should never underestimate, I think, the value of whole of society coming together to say, listen, these are issues that need more attention. So across the states, I guess, critical lessons were no magic bullets. As I mentioned, you cannot solve childhood stunting through simply a nutrition program. That has never happened anywhere, is never going to happen anywhere. It is really important that we pay critical attention to the underlying social determinants along with the coverage of health and nutrition interventions. And this remains, to date, my biggest challenge in communicating with anybody working on nutrition or wanting to make a difference, which is people keep thinking about doing some things within the ICDS, and I keep saying, no, you have to go beyond that. You have to bring in other people. You have to address poverty. You have to support households and families. And this is very difficult somehow still make happen. And I think it is really important that we look at the role of entities working in rural development, working sort of at the level of Panchayati Raj, et cetera, because those are the entities that have the ability to address and bring together actions for all the determinants that we need. Now I look at the evidence. The other piece that we compiled in the Lancet paper was sort of a frame for saying, how do we think about these evidence-based nutrition actions and programs? And I did a little analysis of, well, how does India sit in the nutrition strategy on addressing these? So if we look at what we are currently recommending, we're recommending a set of nutrition actions in the context of direct programs, which in India would be within ICDS and health. And there are a lot of things in the evidence-based recommendations that are being done. Those are all in your black checks. In the red are the things that we are not doing, really not, those to me are not game changers, as in it's great if they're there, it's fine if they're not there. In the indirect health sector interventions, which are largely delivered by the health sector again, so no ICDS again, family planning and reproductive services, very, very important. Disease prevention strategies, very, very important. These are there, but they're not yet integrated with the nutrition strategies in India. And we speak frighteningly little about maternal mental health support. There are other sectoral strategies which directly affect nutrition. Here again, there is quite a lot of work already happening on that in India. What is not happening in India is policies related to reducing the prices, making foods more affordable, to increase access to nutritious foods, and policies to limit the marketing of unhealthy foods. We are really not doing very well at all at connecting promotion of healthy diets with what's happening in our social protection programs. And then very importantly, in other sectoral policies, India's nutrition strategy still does not even fully acknowledge the fact that reducing poverty has to be central to improving nutrition. In a sense, we've removed the idea that households are still food insecure, that people are still poor. We want to run programs in sort of targeting nutrition, but we aren't coupling it with poverty alleviation strategies. So that's a really important place to go, particularly important in the context of COVID. What I'd like for us is to really think about how do you surround vulnerable households. So 1,000-day families are biologically vulnerable. These are families where you have women who've just become pregnant all the way to when their children are 3 years old, or families with adolescents who are likely to enter a new set of life transitions. They're not necessarily, we don't have to think about vulnerable households as poor households, but any household that's in that life stage is a vulnerable household. We have all of the policy efforts, as I've mentioned before. The big challenge is how do you sort of create that circle of protection for these vulnerable families who are in that vulnerable stage of life and bring it all together. And I think this has to be done at a very, very, very local level through Panchayati Raj institutions. And I don't know through what kinds of institutions, if useful at in urban settings. But this is an area for research. We need to understand if this is possible to do. Is it an accountability mechanism? Is it an encouragement mechanism? Is it some other kind of targeting mechanism? How do we make this happen is really very important. I think the Prime Minister alluded to some things like this in his speech this Independence Day, but I think the mechanisms for how to make it happen remain sort of very opaque at this point in time. Now let's talk about COVID for a minute before I wrap up, and I'll try to be quick. So around this time last year, many of us were thinking about, how do we sort of unpack the impacts of COVID-19 on malnutrition in India? What do we think we can expect? And what we honed in on was this idea that the impacts are going to be both direct and indirect, that there are going to be multiple pathways to malnutrition over the short, medium, and long term, and that the way in which these impacts play out are going to be very different for different subpopulations. I think we have not yet learned enough about the direct impacts, although, increasingly there is evidence that people who are infected by COVID are losing tremendous amounts of weight and muscle. So that's just a biological impact on the human body. But we also know that there have been big financial impacts of families, including middle-class families, of having been infected by COVID and sick with this, because it has really sucked up financial resources or affected people's abilities to work. We still don't understand, that pathway very well. We're understanding a lot more about the indirect pathways, which started with us thinking about sort of the impact of the lockdowns and what, was happening in terms of changes to health and nutrition programs, to food supply chains, to education. And I think what we've understood today is that all of these multiple pathways are playing out. All of them are affecting what's going on within households. So they're all affecting the social determinants within households, all of which in turn will affect malnutrition in these affected populations. And I think we still don't know what that play of this pathway is going to be like, but it's important that we think through this. We did decide last year that we wanted to sort of pay a little bit of attention to how food security itself was measured, because it's, as I mentioned, food security and poverty are just such fundamental underlying social determinants, because they affect everything that happens in households. Households that are struggling for food cannot do much else for to take care of children. Everything that happens for children is affected in families that are struggling for food. And so keeping our eyes on food security is actually a very, very good way of understanding household vulnerability. And we do this very poorly in India, very, very poorly. It has been one of my biggest frustrations in all of my years working here. So one of the pieces of work we did was to say, let's look at least how people have measured food security in the context of COVID in India. We reviewed a bunch of work that had been done for using phone-based surveys to understand how they were using and adapting validated tools to measure food security. and to see if we could provide some consensus-based guidance on harmonizing food security measurements. So we collected and reviewed about 15 questionnaires, and really just for organizations that had done phone surveys between March and October 2020. There will be a brief coming out of this very shortly. And we find that it's a real patchwork of measurement, but that most of the surveys had adapted elements of the food insecurity experiences scale or the household food insecurity access instrument. Many were measuring access, but very few surveys were measuring actual consumption or changes in the quantity and quality of foods. Very few surveys were focusing on food deprivation, coping behaviors, or uncertainty around food consumption. And there was lots of variation in how questions were asked and recall periods, etc. This makes it very difficult to say anything seriously and consistently about what's going on for families. So globally, for example, we know that the different instruments that are available to measure food insecurity, and they're all actually very straightforward to administer in the field. So I encourage everyone to look into these, is that they cover sort of these domains of what happens to families that experience food insecurity, uncertainty and anxiety, quantity and quality, food deprivation and hunger, dietary diversity, coping behaviors, and access to food and resources. The Indian tools that we measured, ID Insight and the Hunger Watch survey, were among the few tools that actually tried to cover most of these domains. ID Insight had a stronger approach to measurement investment, and they use primarily the FIES food insecurity experiences scale. Now, despite these measurement challenges, which we documented, which I continue to believe are really profound, because they really affect how we interpret and view findings. The patchwork of surveys that is available totally confirms that food insecurity has been a big challenge in India in the context of COVID. The review of all of these surveys by genres and Somanchi highlights that the impacts have been widespread on eating less food than before, on smaller meal sizes, on fewer meals, and eating less than 2 meals. But our primary conclusion and recommendation is that harmonized measurement is really, really, really critical to track food security and support comparative analyses and help us understand if policies and efforts are working. I contrast the India approach with what was done in the United States, where the census, the US Census Bureau actually administered household pulse surveys in an experimental survey framework to deliver insights on household food insecurity. I think there have been about 6 waves already done in every state with possible disaggregations, data collected consistently, same set of questions. And that has really informed the social policy response in the United States and allowed for the extension, for example, of food and other benefits. In India, we can do better. I think we have the ability to do it. It just hasn't been a priority. Understanding and documenting the problem has not been a priority, and that is a big failure. So in closing, I want to say that, the malnutrition burden of India remains high. It varies tremendously. Both NFHS 4 and 5 also give us some hope for optimism, even as they help us see that the problem is far from gone. Continuing to invest in studying some of the positive exemplars we think can really help to tailor actions across society. In India, we know that the programs in health and nutrition space are reaching more people, but there's really a lot more to be done, and I didn't have an opportunity to go into all of that. COVID-19, we know, has been a major disruptor. We anticipate that it will have impacts that are far-ranging through a multitude of pathways, but our understanding of the disruptions is very patchy because the data investments have not been commensurate at all. I want to, again, sort of really emphasize that solving India's nutrition challenge will take more than tinkering with the nutrition program, and that is what is being done right now. It is going to take much more and many more people and many more efforts coming together at the local level to solve all of those constraints that are really sort of social development constraints at the end of the day. I also want to say in closing that evidence and engagement will really need to remain central to these efforts. I am in too many meetings where people talk too much about either as proponents of certain efforts or as opponents of certain efforts. and neither side has enough evidence to back the claim that something that was done is having an impact, or that something that is proposed to be done is a terrible thing to do. And so I think I've been working on this in India for almost 15 years now, and I remain frustrated by our efforts to use data and evidence to really help us understand the problem and understand how well solutions are working. And I think it's incumbent on our national institutes to be able to do this very well. Thank you.
Thank you, Dr. Menon. Thank you for kind of saying what we've been trying to say. This initiative was basically planned to emphasize how evidence should be used and should be shared for informing policy. And thank you for your presentation. I'm sure we will have many questions, and we'll open up for questions after our final presenter is there. And I would invite you again once the question answer starts. I would now like to invite Dr. Giacomo Zanello. So can you unmute yourself?
Yeah, I'm here.
Okay, I'll give you the presenter status. And
thank you very much.
I also have your presentation, so if anything goes wrong, I can present it. So I would first like to introduce you before I give you the mic. So Dr. Giacomo Zanello is here with us. He will share his very exciting research on energy expenditure in agricultural and rural livelihoods in India. He is an associate professor in food economics and health and deputy director of the Graduate Institute for International Development, Agriculture and Economics at the University of Reading, UK. He is also a fellow at the London Centre for Integrative Research on Agriculture and Health at London School of Hygiene and Tropical Medicine, and research associate at the Technology and Management Centre for Development at University of Oxford. Giacomo is serving as a core member of the Independent Expert Group for the Global Nutrition Report. His specific area of expertise is food and nutrition economics, and main research has been concentrated on efforts to understand how agriculture, food, nutrition, and health interact, especially in the low and middle income countries. Previously, Giacomo was a research fellow at the London School of Hygiene and Tropical Medicine, supporting the work of Global Panel on Agriculture and Food Systems for Nutrition in its commitment to tackling global challenges in food and nutrition security. Prior to that, he was a research officer at Oxford University's Department of International Development. So welcome, Dr. Giacomo, and I would now give you the mic to present your results. Thank you.
Thank you very much. Thank you very much for the introduction and for the invite as well. So good afternoon, everyone, and thank you for attending today's session. My name is Giacomo. As the introduction said, I work at the University of Reading. I'm an agricultural economist by training, but I've been involved in issues related to agricultural health and nutrition for a few years. What I would like to present today to you is part of the research I've been doing in trying to understand a little bit more the role of energy expenditure in agriculture and rural livelihood. And I will present more the results about India and the work we have done in India. I think the first presentation that we have attended today define very well why energy expenditure actually is an important information, is an important piece of data when we talk about hunger. Hunger is having not enough food to sustain your body and not having enough food to sustain the activities that you are doing. Now, this clearly is different for every people. Certain age group or certain age group might need higher energy to keep their body working. Certain activities might require more energy to be done. So these are the reasons why why considering energy expenditure might provide us a little bit a more comprehensive information when we talk about hunger. What I'm going to do today in my presentation is sharing with you the work we have done in this respect, in trying to understand more how to capture energy expenditure and how the information on energy expenditure can have implication in policies and programs. The presentation that I will be doing today is more specific on the analysis that we have done in India, in the Telangana state, and tends to be for an audience not just a policymaker, but also practitioners. So I will touch upon a little bit on what means collecting energy expenditure and how we collect energy expenditure. So we have been working quite a bit on this domain for the past 4 or 5 years. And I wanted to make very clear from the very beginning that it's my pleasure being here to present the work. But behind this work, there are many more people and mind that have informed what we have done. In specifically, what I would like to mention the work that NRD have done in this domain. Professor Radhika Cherikuri and Dr. Nitya Gaudru was involved since we really developed these new methodologies a few years ago, and they've been a key role in implementing and developing our research agenda in India. In addition, there is Tufts University in the US and Varg and University of Development Studies in Ghana and in Nepal, respectively. So why then we want to capture physical activity in rural low middle income countries? In addition to the discussion that we have done earlier in terms of hunger, more specifically, I wanted to mention this idea that when we talk about agricultural intervention that aim at increasing agricultural productivity, we needed to consider what those intervention, the impact of those interventions in nutrition and health outcome. And we know that the pathways from which a productivity enhancing agricultural intervention have on nutrition and health could be very complex. It's not just a matter of increased productivity, it means increased consumption, but there is all a series of different pathways that can play, specifically in terms of the trade-off that people need to make when they take upon those interventions. So the starting point is that the link between productivity enhancing agricultural intervention and nutrition and health, it's quite complex. In addition to that, when we look at how we have been studying nutrition in low and middle income countries, there has been a focus on diet, predominantly on diet for the past few decades, while changes in physical activity have been somehow neglected. In addition to this, another consideration of why physical activity could be relevant in rural low and middle income countries is that the impact that productivity enhancing agricultural intervention have in the calorie deficit could go through also the energy intake, but as well the energy expenditure. So the idea is that yes, increased productivity might translate in increased availability of calories. However, how that translate, how that take into account the energy expenditure. So I would like to make an example. For example, if a new technique, an agricultural technique that increases productivity requires more effort, more energy expenditure from the farmers to implement that. Is the increased yields covering that additional increase of energy that is taken to implement the production of that specific good? So what we are trying to say that we want to bring back in the equation also the energy expenditure when we talk in terms of the overall impact of agricultural interventions. So what we have done with our research. With our research, we have predominantly developed a methodological framework in which we collect energy expenditure data from accelerometer devices. I will explain a bit what that is. And we integrate that data stream with activity and time use information and food intake information. So somehow we are triangulating 3 different streams of data, and that allows us to look at a combination of factors in a way that it was not possible before. How this new method could help us to understand, or what could help us to understand better or to facilitate? So the first, and I link a little bit with the previous point in the previous slide, we could, knowing energy expenditure, having access to energy expenditure data, allow us to link to facilitate the link between agricultural development intervention and nutritional outcome. That because we are take into consideration as well the energy expenditure or the trade-off in terms of energy expenditure that household or certain member of the household might do when they take upon new technologies. The second allow us to have a more granular understanding of the trade-off that household and within a household household are doing and within a household we are seeing. More specifically, part of our work was looking at the role of women in the household and how the energy expenditure can help us to better understand some of the consequences of some of the choices that women needs to do within the household in terms of allocation of labor. Then finally, the point that we were discussing in the previous presentation, we can get a better understanding of the prevalence, the depth, and the severity of undernutrition. If we get a better understanding of the role of energy expenditure, then we know better what are the requirements for people. And requirements might be different for different physical activities that people are doing. So I'm gonna talk in the remaining part of my presentation in three different parts. The first, I would like first to introduce a little bit the methodology and the study design that we have been using and developing to capture and to integrate the energy expenditure in our research. I would like to talk a little bit about the policy and programming insight that we can have with the data, with the energy expenditure data at the micro level. And in doing so, I will present a couple of the research that we have done and how our findings can actually inform that. I will finish and conclude the presentation with some field considerations. This is more for practitioners, what it means collecting energy expenditure data. We see that is a useful additional piece of information, but also we need to consider the consequences and the implication of that. And we will see how we need to consider different trade-offs during the field. So if you see the photos, the picture that we find in this slide, you will see that all the person in the slide are wearing a small device in the waist area. That device is a small red box, and is what we call an accelerometer. It's a device that captures movement, and if we know the mass of a body, and we know the movement in terms of direction and acceleration and speed, we can capture the energy required for that body to move in a certain direction. And that is the principle of accelerometry devices and how we can derive from movement the energy expenditure of people. We use some specific research-grade accelerometer devices, but every mobile phone nowadays got an accelerometer inside. So actually the technology that we are using is not a very new technology. I will go back a little bit more with some detail about the devices later. But to give you this idea of the framework, the methodological framework that we have been developing, is very much looking at the role of trying to find ways in which we can capture energy expenditure, and we do that with accelerometer devices. But also we want to capture the food intake and the time use and activity that people are doing. And then we develop this methodology in which we administer daily surveys with food intake information and time use information. And then we triangulate that information with energy expenditure. So energy expenditure and time use data are telling us what people are doing and the energy that they are spending in doing certain activities. Energy expenditure and food intake are telling us the gap between how much people are spending and how much food they are eating in terms of calories. There might be a deficit, so people are not eating enough for the activities that they are doing, or there might be they might eat more than the energy that they are spending, and then there might be an overnutrition in that sense. So we have developed this methodology, and as I mentioned, we have been using those accelerometry devices, which are called Actigraph because of the company that makes them. The difference with what we can find more easily, like a Fitbit or other devices, is that are research-graded devices. So we have access to the raw data, and that allow us to have a more detailed estimation of the energy expenditure. And those are devices that have been used quite extensively in many different contexts and in different subpopulations. So that also was a rationale for that. Something I wanted to mention is that it's a good measurement device, but it's not a perfect measurement device. The idea is that the positioning of the device determines the energy, but different activity might not be taken if the device is positioned in a certain way. So the devices in the waist area is where most of the activities are captured, yet it's not perfect. Think about going on a bicycle. If you go in a bicycle and you have your accelerometry devices on your waist area, you do not capture that movement because effectively you are sitting, your legs are moving a lot. In the same time, the accelerometer do not capture effort, it captures movement. So if I walk, or if I walk with a bag on my shoulder, the accelerometer captures the same intensity of physical activity. So I wanted to mention this because I will go back to this a little bit later when we discuss the pro and cons of that. We are going to use data that we collected in India a couple of years ago. We collect data from 40 individuals, a male and a female in each household. and we collected through different agricultural seasons, and each person was followed through 4 non-consecutive weeks, so 7 days for non-consecutive weeks. Even if we have a small initial sample, actually the overall sample becomes very, very large very soon. So at the end, we have a little bit more than 1,000 person days and more than 26,000 of hours in which we were able to match the activity for a person with the energy expenditure. So what we have done, we have, I'm going to present today 2 different set of research that we have done with the data. The first one was a research in which we ask ourselves, what is the effect of drudgery reduction? So if we were to substitute less intense activity with more physical activity, what is the effect on energy requirement? And what we have done, what we have seen is that a reduction of energy expenditure can have an effect on the energy requirement between 17 to 24% for male and 14 and 17% for women. So what we ask, what if the people were doing a 1 hour additional hour of light activity and reducing respectively moderate and vigorous activities? And we see that the range changes quite a bit, and changes quite a bit because it depends not just on the sex of the participant, but also on their household characteristics. So we have simulated different household characteristics, and we see how the drudgery reduction actually have a different effect for different participants. The second part of what we have done is looking more at the gender role and how energy expenditure are different in terms of allocation and trade-off of time use and energy expenditure for women and men. We find that both women and men participate in productive activity, but most of the women shoulder reproductive work at the expenses of leisure opportunities. When men tend to have leisure time, women tend to work in reproductive work. So how those results kind of field can inform policy? The next 2 slides, I will take the 2 research and discuss exactly this. So in terms of the drudgery reduction, we have seen how actually labor-saving intervention have the potential to impact the calorie adequacy, even if the improvement in food intake is not there. So when we think about the intervention in agriculture, we need to think as well what are the savings in terms of the energy expenditure, and that can have a direct effect into the requirement that a rural household need in terms of the energy to work in the fields. However, also what we highlight in our work is that the differences vary by gender, but also by social demographic characteristic of the household. So we have seen that people with larger land plot, for example, the saving is larger than for people with a smaller land plot. So when we talk in terms of drudgery reduction, we need to consider also that the effect will be different, and that will need to be taken into consideration when we promote new agricultural technologies. And then finally, a consideration about rural infrastructure and the role that rural infrastructure might have in terms of energy expenditure, but that also in as a consequence in nutritional outcome. For example, not just in terms of agriculture, but in terms also facilities in rural villages. So people don't need to travel far away for essential facilities. That will have inevitably an effect in terms of energy expenditure, but also in terms of the time and how the time is used by the people that are using those facilities. In terms of gender-sensitive agriculture programs, the idea that actually the role of gender dynamics within the household influence the energy expenditure of women and men because of the different trade-off that women and men are doing within the household. Can have quite a profound implication when we talk about gender-sensitive programs and intervention. So first of all, this idea that the trade-off that we can observe in the time use data also can be corroborated, can be expanded in what that means in terms of energy expenditure. And I think that this is quite important because the trade-off that women and men are doing in the household is not matter just on how they spend their time or how they need to spend their time, but also how they allocate their energy and the nature of the work that they are doing. So it's important to consider as well all the intervention that can be tailored to reduce the women workload in the household, can support as well the allocation of not just time, but also resources and energy of women, which could potentially go into formal and better paid economic activities. Just to finish, and I will finish in a couple of slides. I wanted to provide a little bit some consideration about collecting energy expenditure on the field. We have discussed about the insight that this new stream of data can provide. However, I wanted to put also some consideration of what actually means collecting data. Like many data collection, there are implications in terms of cost and in terms of training, and not just in terms of procuring the accelerometer devices, but also training and the time that is needed to use the devices on the field. And also this idea that we get a very rich data, but also is not feasible in our experience for large samples. So inevitably it's going to be always with small subsample, yet it can provide very useful information that can then be used also for a larger sample potential. We have developed a manual for practitioners. So if you are interested in collecting this kind of data, the manual is supposed to guide you on what we have learned, developing and applying this methodology in several countries around the world. So that could be something that could be useful. And also is a fast evolving field. So as I mentioned, we are using certain devices, but technology is moving. And actually what we are doing is not something that a mobile phone could do. And most of us keep their mobile phone in our pocket most of the time. So actually there might be in the future opportunities to capture energy expenditure for much larger sample in a much easier way. So those are the kind of consideration of using the accelerometer on the field. And I would like to conclude a little bit with 3 takeaway messages of this presentation. And I go back to the idea that energy expenditure could be in certain context and in certain situation an important piece of information that maybe at the moment we were not, we didn't have access to. So this idea that energy expenditure can have a key role in understanding the energy requirement of people in a way that can be tailored based on different age group, different sex, but also different activities and access to different endowment. Not everyone, for example, work in the field with the same technologies. And that clearly will have an effect on how the energy that you are, that people are spending on the field. I'm going to conclude with a word about policies and the idea that most of the intervention actually have a direct or indirect effect as well on time and energy use. And this might have an unintended negative effect on the household nutritional status as well. So I think that time use is something that is more is a consideration that is more common nowadays. But I wanted to stress this idea also with the trade-off in terms of energy expenditure that derive from the time. So thank you so much for your attention, and I give back to you, Rokira.
Thank you, Dr. Giacomo. Thank you so much. We have come to the conclusion of this panel discussion, and what a wonderful and energetic panel we had. We started from the narratives of gloom and we have come back to the narratives of hope. And with that, I would like to open the floor for questions. Before I do that, I have certain requests from those who are present here. First of all, please, all of you, please turn on your video. I have made this request in the chat box earlier as well. It's actually very unsettling to talk to names and black screens. So please turn on your video, at least for the interaction session. And those of you who have joined as Acers and Lenovo's and CEOs, kindly please join with your name because we don't know who you are. And it's an interaction session. We would like to know who you are. We have gagged all of you for obvious reasons that there are no disturbances. But those of you who want to ask questions directly, do raise your hand. We will give you the, we will unmute you from our end. And those of you who want to drop questions in the chat box, while you are dropping the question, please clarify who the question is directed to. Otherwise, I will not know who to ask the question. And yeah, the floor is now open. Before I invite questions, I also have my two colleagues who are my co-coordinators of this project, Dr. Rajesh Kumar Sinha and Dr. Partha Pratim Sahu. Please raise your hand so that I can find you. Hi Rajesh, Partha. Do you have anything to add to this? To this debate that we had today? Partha, I'll start with you.
Maybe later. Let us invite questions from the audience.
Right.
And if we have time, I will also pose a question.
Right. Okay. Okay. Rajesh, what about you?
Yeah, no, I don't have.
Okay. Okay. Please ask the question. So I first have one question from Videsh. The question is to Dr. Menon, and he is asking that in Chhattisgarh under the Mahatari Jatan Yojana, he has observed that per plate it's 9.5 rupees for a meal. But then even a cup of tea otherwise in the market is 10 rupees. So how does the state ensure that in 9.5 rupees people will have a nutritious meal? Like, what are the mechanisms? How do they come to that amount of 9.5 rupees? That question is to Dr. Menon. Yeah.
Should we take a few questions and then maybe answer them together?
Yes, so right now there is just one question. So maybe we can start and people will slowly come up with.
Okay, okay. I mean, I'm not a program implementer, but my understanding is that those are additional costs above the standard THR costs in the state. Besides which, when we think of the 10 rupees, for a cup of tea or whatever spent at an individual level, but I think when at a program level they're making allocations, you have some economies of scale. I should also, of course, say that I don't believe that that is necessarily enough. I just think that, when you're cooking food for the collective, there are going to be some economies of scale. I think there is still a lot of work remains to be done to effectively cost a nutritious, safe, and healthy meal if we intend to offer these meals through community-based programs. Very often the intent and the design of the program is sort of energizing, but then the financial allocation does not allow that program to be delivered with quality. And I think there just has not been enough work on this. So it is really important that people continue to ask those questions. And, when we are doing the research sort of in the field, to really be able to ask, how are those funds being used? Is the program that's on the ground, which is basically being delivered by the available funds, is that actually delivering quality or not at a unit level? And if it's not, then what does unit level quality actually cost? I've done a lot of work on nutrition financing, Kapoor and others from the Center of Policy Research. And in the context of these kinds of food-based programs, so the nutrition, supplementary nutrition, etc., we always end up having to use the cost norms of the government. Basically say, okay, this is how much should be in your budget, if this is your cost for the program, and this is the target population. Because unfortunately, nobody has done micro level cost of the cost of delivering a quality food. So anyone who's interested in that, I think this is a very important area for research. I hope that's helpful.
Thank you, Dr. Menon. So I see we don't have any question. There are just a lot of excellent session, nice session, and those kinds of messages. But I have a question, which is, I'll just, this is for Dr. Giacomo, but also to Dr. Menon. I hope like the two of you, between the two of you can answer that, because I have followed a few resources that you have done with women empowerment in agriculture index and how you are working on time poverty. And then one of the presentations that was that I attended in the recent UNH Academy webinars is how the results from the ethnographic anthropological survey on intra-household power dynamic and the results of time poverty kind of contradict at times. So there was this study that was mentioned that in Nepal, the time poverty of the mother-in-law and the time poverty of the daughter-in-law is, eventually the same. But whereas when you ask about the power dynamic within the family, the mother-in-law must be more powerful. So can we use energy expenditure that you have using this kind of device to kind of unpack that further and see that whether even within the same kind of time poverty, we can capture this, this power dynamic between the family members? Is there a possibility, or we still have to have more?
Yeah, it's a very good question. I would say that could help, but it's not the one that really is not a silver bullet. In a sense that time poverty, we could intend that as depending on the nature of the activity that you are doing. So there might be very tedious activities, but they are not energy intense. But there might be also very intense activities in terms of the energy requirement. So I think that energy expenditure could provide an insight in better defining the nature of those activities in terms of the requirement. But as I mentioned, it's part of a triangulation of different data stream or different information, both quantitative and qualitative. Something that I think is also very important, I haven't mentioned, is this idea trying to go beyond the activities and the energy, but also trying to understand and talk with people the way in which they are doing certain activities or why they decide to do certain activities. So there is a lot of scope in integrating this sort of data with also qualitative data. And possibly to answer your question, such a more mixed method approach could be very valuable.
Thank you, Dr. Zanello. Dr. Menon, do you want to add something to that before I go on to other questions?
I guess I'm not necessarily surprised by that finding. You know, two people can be equally busy or have equally full days within a household, but if one is doing what they want to do and the other feels that they are not able to control that time, that's how you likely see the power dynamics play out. You know, so I'm not surprised about that. I guess the question is always, what do we do with information on differences in time poverty and differences in power dynamic? And I think in this area of work, we remain largely in the space of documenting this and understanding what it looks like, both empirically and qualitatively. I think it's very, very nascent, it feels like. I mean, I remember there was work on, that I read in sort of the early 90s on time and labor dynamics in Nepal. I think it was Michael Pauliso or something's work. And then there was a whole period of time when there was very little work done on that. And it's great to actually see it come back, because I do think that this is one of the very, really fundamental aspects of structural sort of the dynamics of households, and whether individuals within households, get to have lives that are also fulfilling to them as individuals, without documenting sort of the differences in time dynamics in where people's time is going, and how they themselves feel about that. I think we're going to continue to struggle to, deliver or provide policy recommendations or interventions that actually lead to, days being fulfilling. I mean, women are continuing, not just in India, but especially in South Asia, but even around the world, spend time on things that they are not interested in spending time on, endless household chores, endless decisions about food. Somehow society has decided that we are the ones to make those decisions, without asking whether we are the ones who want to make those decisions or enjoy making those decisions. Without documenting those imbalances, we will never be able to have those conversations. And I feel like we are still there, in documenting in ways that allow us to have these conversations.
Thank you, Dr. Menon. Thank you. We have some hands raised. I will start with the CEO of South Andhra Pradesh. Sir, I'm going to request you to unmute yourself. There will be a pop-up in your screen. Kindly click on that and you can ask your question.
Yeah, madam, good evening. This is not CEO. This is Director Non-Farm Livelihoods from Surf Andhra Pradesh. Yeah, this is a little bit vague question, but sir, we are working in tribal areas. So what our main question is, how to overcome this malnutrition and hunger kind of thing in tribal areas of Andhra Pradesh, particularly. So is there any strategy to adapt those? This is to Dr. Menon, madam. Yeah.
Dr. Menon, you want to take that?
Yeah, I would point you to that, the circle of protection piece that, that I really have been using a lot in helping people think about the importance of really tackling structural determinants. I mean, yes, while tribal populations may have their own preferences about food and other such things, I think all populations have preferences. Question is, what are the other aspects of, marginalization around tribal populations that can be addressed through the programs that, that are available in the hands of the state, and how do they sit with what the, what tribal populations themselves want? But I would encourage us to really think about, what does that circle of protection, if you will, look like for 1,000-day households, even in tribal populations, and what more can be done through available policy interventions and programs that serve. I admire tremendously the work of SERP. I think you all have game changers and trendsetters, I think, in thinking through programs that engage women. At the same time, and all of our work that we've done recently, especially in sort of women's self-help group programs, etc., we've also understood that there are many challenges facing women that cannot be addressed by women's self-help groups. They have to be addressed by either engaging men or engaging other people in power in those communities, or by deploying other, straight up development programs that change the context in those communities, making access to roads, access to water, access to electricity, sort of policy level interventions. We really come back to this idea of we can't improve women's lives just by asking women to improve their own lives. It is simply unfair and not the way that we should be doing things. And it is not how development has happened anywhere in the world. We sort of really need equal efforts from everybody in that policy landscape. But I think I would really, conduct a diagnostic, actually, keeping that sort of circle of protection, circle of care, the action framework that we have from the Lancet as well in mind, and say, how is that operating in that local context for those tribal populations, and who needs to act to change those?
Policies.
I hope that's helpful. I'm happy to join in further conversations.
Yes,
Yes.
thank you, Menon. Maybe we should
Thank you, madam. One more question. Thank you.
diagram that you have shown for the tribal areas as well. I would now like to invite.
One more question.
I would like to invite Dr. Anita Brandon. I think she is unmuted. Madam, can you hear us?
Can I speak?
Yeah.
Am I audible?
Yeah, you're audible now.
First of all, I would like to congratulate NIRD for putting together such energizing and enriching events by way of these SDG-based, evidence-based policy discussions. We had on poverty already, and today on money. It was very fascinating to get the evidence from all the speakers today. My observation and question is directed towards what we learned from Mr. Zanello, but my suggestion is towards NIRD and other national institutions. It was very fascinating to learn about the use of accelerometry devices, impact of energy reduction, drudgery reduction devices for reducing energy requirements, and doing generative studies on this. So while you have experimented with drudgery reduction in agricultural activities for women and for men, but I think there's a lot more required to be done in terms of household chores and activities that women shoulder, which are largely invisible, and which will include collecting water every day for the household, which itself entails walking miles in rural areas even today in India. Although there is Mission Jal Shakti and there is ambition that by 2022 we will have taps in every house. Taps, we are saying, water is guaranteed, not safe water. So far, we only have Puri as an example in the country, Puri in Odisha, which has 100% safe tap water for its citizens. So we have miles to go on this. Then we have the whole issue of women collecting fodder for the cattle every day, fuel wood. Of course, there is the scheme called Ujjwala, where LPG gas connections were given to village women and households. But now they're going up, and 60% reduction in again, women are back to square one. They are again having to shoulder collection of fuel wood on a day-to-day basis. So when you look at all these household activities which women perform every day in terms of gathering water, collecting fodder, collecting fuel wood, looking after cooking, cleaning of the house, care of children, care of elders. So a lot more needs to be done in terms of coming up with drudgery reduction devices and energy reduction requirements. And the ball is in the court of institutes like NIRD and its sister institutes, SIRD, and others, to Terry, who will have to take up this cue, because you are focusing on agricultural activities, but a lot more is there in the portfolio of women in day-to-day work, investment, time used, and their expenditure of energy on various household activities. So that is one which is very important to be flagged here, and national institutes should take up more such research and promote more such drudgery reduction devices. And of course, Professor Vikas focused on how there is surplus food grain production, but there is not systematic distribution, which is a big, huge challenge. And with the disruption of schools in the wake of the pandemic, the whole midday meal initiative and other such nutritional initiatives have come to a grinding halt. And despite the Poshan Abhiyan, they need to be taken up and energized again. So these were questions intriguing me for further probe and research, and also to flag before this August audience. Thank you.
Thank you, Dr. Brandon. Dr. Giacomo, will you like to respond?
Yeah. Thank you very much. Thank you very much for the question. That allows me to explain a little bit more what we have done. So we follow the participants, so male and females, for 7 full days, so 24 hours in a day. So we are not actually just looking at agricultural activities, but we look at everything that men and women are doing in 24 hours for 7 days. So a lot of the reproductive, what we call reproductive work, so effectively domestic work, we are able to capture that, and we do capture that. However, I think the question that you pose raise a very important point. That is the one that there is scope for drudgery reduction, not just in the agricultural world, but also within the household and in many different ways. And that is a little bit the point I was making in my presentation as well. I wanted also to mention that what we have done with our work, we call it a case study, because effectively are 40 households. So it's a very, very small number of people, very specific characteristics. But there is scope to understand more other kind of household, other context, other economic systems, and other culture as well. For example, part of what we have done, I haven't presented today, is working with adolescents. So we are looking at other age group as well. We have also looked at the role of public work programs, like the MREG program, in terms of energy expenditure. So is what we have done, it's almost a pilot, something to learn how to use this technology, but that can used in many different contexts. And all the question and the point that we're raising in the question itself are very important point from which we do not know probably enough, but will help us to understand more the household dynamics, energy requirements, but also the trade-off that people are doing within the households.
Thank you, Dr. Zanello. I hope Dr. Brandon's question is answered with that. And I would request Professor Rawal to unmute himself. He wanted to ask a question.
Thank you, Ruchira. I had a question to Dr. Giacomo and a comment for a very, very insightful and extremely useful presentation. For anybody who's been interested in issues related to measurement of hunger, I can't say how useful this was. So thank you very much. I just wanted to ask you one question, which is that from the data that you have you been able to relate the level of energy used with occupation? And can one say, how much energy is consumption does an average agriculture worker has, and construction worker, and so on and so forth. So can one get something that relates occupations to energy use? I ask this because in the work that we did on modifying the way prevalence of undernourishment is measured, that was one critical component on how to relate, say, NSS data on employment with, benchmark it with energy use. So if you have some data on it and information, that will be very useful. The other thing I wanted to mention is more of a comment which one slide in your presentation got me to think. Very often we talk about reproductive burden on women and talk in that things that are not really reproductive burden that needs to be on women. I mean, care work. I mean, these are not biological responsibilities of women. These are socially determined work that is primarily born by women because of the way the gender imbalance is there in the society, and should certainly not be taken to be granted. It's not like, this is the burden of the reproductive work that women have, and therefore, what can we do to reduce the economic burden on them? I mean, we should perhaps be thinking the other way. What can we do? What can the society do to reduce the burden of care work on women? Why can't we just have better creches and better facilities, and why can't husbands be, sharing that burden, and so on and so forth? And keep that as also, aspects of women's time and the labor use, which are socially determined and can change. Thank you.
Dr. Giacomo?
Thank you very much for your question and comment. Very, very insightful. I start for your comment. I completely agree. Probably I didn't have enough time in the presentation to develop more the argument that we make about the differences that we observe between women and men. I will be happy to share a part of the work that we have done that will help us, will help a little bit to explain more, but is definitely this role that they have in the society and how that affect the labor. In terms of the first question about occupation, yes, it's possible to capture the energy expenditure for different occupation groups. However, what we have done is working so far predominantly with agricultural household, with rural household. So somehow they are quite homogeneous. They all work in agricultural activities. But what, even within the agricultural activities, for example, and this is something that we were able to capture, is the differences across different agricultural seasons. Activities that are during the land preparation are different than what we can find during land maintenance or harvesting, for example. And interesting, we see how also the role of men and women are different. So we see that women might be more exposed and giving a greater role during certain agricultural season in terms of the work they're doing in agriculture. It's definitely possible to do it for different occupational groups. It's quite straightforward. I would add a couple of considerations. The first is we need to look at to what extent we are able to capture the energy expenditure given the kind of movement that different activities might have. Again, a movement in which you are sitting, for example, but then you move, there might be a situation in which you have a larger energy expenditure than actually how much is captured by the devices. But also, if we go in a more granular way, the same activity could have different energy requirement given the different technologies. So, for example, let's go back to the agricultural activities. If I say I'm plowing, well, you can have different energy expenditure given if you're plowing with an animal power, for example, rather than manually. So then it becomes very granular, our definition of what is the energy expenditure for specific activities, because the details matters when we talk about that. Nevertheless, we can definitely get a better knowledge of this requirement, which could help us in different ways. So thank you so much for the question. I hope I addressed it to some extent.
Thank you, Dr. Giacomo. Thank you, Dr. Rawal. We have a few more questions in the chat box. One is, I see Dr. Menon has already responded to that, about recommendation about 2-3 policies towards zero hunger. Yeah, so I'll just put it to closure, I guess. The other one is a clarification from Moshumi, who wants to know if it is possible to provide for community level machines, solar powered ag tech machines, which can help reduce the amount of time and energy spent. In the US, there are these community low-cost washing machines, which are really useful for urban poor families. Moshumi works in NCAER, and I think her question is directed to Professor Zanello, but I'll open it up to all the panelists for them to address. Yeah.
I just wanted to make a couple of comments on the zero hunger piece. Again, just to emphasize what I had mentioned earlier, and that I think Professor Rawal also mentioned. We're trying to track progress to something towards something that we're not measuring, that we have decided is not worth measuring somehow, or when measured, not putting that data in public domain. So we are going to remain stuck with the FAO estimates of undernourishment, which, of course, they are the benchmark indicator at some levels. In a way, we can say, okay, it's fine. We're going to avoid sort of doing any real measurement of food insecurity or hunger in our communities at the community level, because the benchmark indicator for the SDG is the food balance sheet kind of measure, but that's really inadequate. I think as a country, as a nation, as a society, one must take a much fuller view of what zero hunger means. One must make investments in measuring that, and in really looking at who's affected where and how deep that is, because without that, you're not able to get societal actions. One of the most powerful things measuring hunger in the United States has been the extent to which not just it has influenced policy measure, but the extent to which it has measured societal attention to the issue of hunger and to the issue of child-level food-related poverty. The number of NGOs, food banks, food pantries, churches, faith-based organizations that work on hunger in the United States is unparalleled in a sense. And it is because 25 years ago, people pushed very hard for community ground-level measures of hunger to be available. And they're available on an annual basis in the US. There are 5 or 6 questions that's all that are asked in annual surveys. In the context of COVID, this Bureau has asked those same questions 6 times in the last 18 months. But it has elicited both a societal, civil society response and a policy response. And I think it's really incumbent upon those of us who care about hunger and food security to be very pushy, to ask for data that is available, to be made public. When data is not available, to say, okay, then we can come together as academic alliances or whatever else to invest in whatever we can to further that measure, because without that, it is very hard to get, people to care if we cannot tell stories that are backed up by data. The FAO food balance sheet is not a number that elicits a societal response. It may be a number that can elicit a policy response, but we need both site media policy to be energized around the issue of zero hunger. It is really fundamental to, to that. And what we have in India is a very small group of activists who are relentlessly trying to do whatever they possibly can. But that is too small a group. I think everyone who works on these issues has to ask for that data. I will tell you today, the Comprehensive National Nutrition Survey, if you look at the questionnaires, it has questions on the food insecurity assessment scale. It can tell you what the pre-COVID food insecurity situation was in every state in India. That data has not been released to public domain by Ministry of Health. As researchers and people who care for the issue, we should be asking for those data to be publicly available. There should be much more agitation around these kinds of things. We're trying to solve a problem for which we are not investing in adequate measurements. I would really love for NIRD, for all of you on this group to, in a sense, help figure out how we can get a measurement of the problem that we are trying to move towards solving. That's the last comment I want to make, but it bothers me tremendously. Thanks.
We would definitely like to talk more about this with you. I've told you that we want to continue the dialogue forward. And yes, data is of course a huge issue, and as researchers, as people who work with problems, putting together narratives, even to train our functionaries on different issues. So yes, data remains an equally important issue for us, and of course I would like to take it forward. We have one last question.
Can I make a comment on this the question by Pranav?
Yes, sure.
I think it's an extremely important point that he has raised, and it's very important to raise it. And I say this from there are several reasons why this is very important. Sorry, Dr. Srinivas is up. Can you mute Dr. Srinivas?
To everyone else.
Dr. Srinivas.
Mute everyone for a second.
Hello. Dr. Srinivas is. Dr. Srinivas adjourned. Hi, yeah. So I was saying that there are actually 2 or 3 reasons why this is very important. One is that this was given wisdom that poverty and food security are there's a very close relationship between the two. But it's very strange, in the global discussions today, that there's a clear attempt to break that relationship. You just look at the major publications on food security, and you would find increasingly discussion on conflict as being a primary determinant of food insecurity, and not poverty and deprivation. It's really interesting how there's an attempt to shift the focus away from relationship between poverty and deprivation and food security. Okay, so that raising this is extremely important. That said, the conventional wisdom has also been that merely reducing poverty is not enough to necessarily deal with food insecurity. So you could have situations where people who are not generally poor may face food insecurity at specific times, seasonally, during periods of crisis, and so on. So it's not enough to merely deal with poverty and expect that food security will not exist if poverty does not exist. That's been the conventional wisdom, and that's why, in fact, in the Indian context, poverty alleviation programs specifically targeted food security. And why did we have this whole system of grain distribution? I mean, because there was this whole recognition that food insecurity is an important problem, and it needs a targeted intervention directed at food insecurity. But it is an intervention that also recognized that at the root of food insecurity, you have the problem of poverty. So identifying the relationship, having it at the core of your strategy to deal with food insecurity is important, is essential. But at the same time, you need to go beyond that and make sure that, on the margin, you're also able to deal with people who face food insecurity in specific contexts. And I mean, there's been a period where the food security, the biggest food security program of this country, the public distribution system, was narrowly targeted to PPL population. That's the kind of mistake that we've made, to think that only those who are below poverty line, there is food insecurity. Okay, so it's important to understand the relationship, but it's also important to understand that there is a difference. But it's, I mean, I'm very glad that you raised this point, because I mean, raising this point is even more important. So thank you very much.
Thank you, Dr. Rawal. Dr. Menon, would you like to have any addendum to that?
No, I just want to say I agree 100%, and this is precisely why many of us have been calling for the experiences-related food insecurity measures, which are available, which have been available for a very long time, to be integrated into sort of consumption surveys, because they really help you make the difference between, poverty cutoff based.
And also, I think the poverty goal, you are talking about multi-dimensional kind of a poverty, not the income poverty, it's the BPL.
I think, yeah, and I think we have to look at both. But I should say this. I think it is also still kind of challenging to me that India does not have a single national poverty reduction strategy. It does not exist.
Yes.
There is no single document in India. We have a national nutrition strategy. There are health-related strategies that relate to those SDG goals, but there is no single poverty reduction strategy that says we recognize that this is where the poor are in India, this is who the poor are in India, this is what the poverty dynamics have been, and this is our strategy around that. So I think what you see is a real patchwork of issues. And then we've never sort of really reconciled this idea that, that food insecurity is about so much more than just, not having enough calories to eat. It is a very, profound experience for families to be food insecure, whether it is seasonal, whether it is, sort of chronic. It affects everything in people's lives. And by not measuring food insecurity from an experiences perspective, I think we diminish that. We don't recognize that problem. And therefore, you don't tailor programs and policies to actually address those effectively enough. So I think there are some really big issues to be dealt with on, both on the poverty side and on the, on the food security side of things. And I'm really, thrilled that we're able to at least have this conversation, but it has to go beyond that. Thank you.
Thank you, Dr. Menon. Dr. Zanello, I would like to come back to you, because I think originally Dr. Pranav's question, I am just now reading it, the full sentence, it was directed to you. Would you like to have any thing to add to the agricultural policies in India? He wants to have the specific.
Yeah, no, I appreciate it, but I need to be honest, the previous presenter have much more experience on the Indian context in agriculture, so I think that I don't have anything really to add on that, so thank you.
Yeah, thank you, Dr. Zanello. I see there are no more hands raised, but I do remember that Partha had a question and he wanted to ask after the question answer was over. So I would like to invite Dr. Partha Sahu to ask the question. Why can't I find?
Yeah.
Okay.
Okay. So my question is, maybe all three panelists can reflect, but maybe I would like to hear more from Dr. Menon. when we will start talking more about food literacy rather than financial literacy, one. And do we have any study where we have found that food literacy has demonstrated the better implementation of a food program or something like that? That is my question.
Sure. So I think I'll just say that the ideas around food and nutrition literacy are very much encompassed finally in, in Poshan Abhiyan, which has had a big emphasis on nutrition-related, behaviors and supporting behavior change and awareness and things like that. And there's actually quite a lot of research in the region, not just in India, on how programs that target sort of food and nutrition literacy and awareness can have had an impact on people's diets. At the same time, I think what we have really learned from all of that research is that there are, the structural determinants of people's ability to respond to food literacy and food awareness are also really important to account for. And so where programs have tried to address those structural constraints, so for example, either by providing both programs and efforts to improve people's awareness about good nutrition together with, say, either cash transfers or food transfers, but especially with cash transfers, we have found better impacts on all kinds of nutritional gains. And I think, so there is a lot of evidence available on that, on behavior change and food literacy. I think the language that may be used across professional fields is a little different. In my world, we call them behavior change communications programs or social and behavior change communications programs. Others may call them nutrition literacy and nutrition awareness. But I think, what we've learned is that we can have change, they can improve nutrition behaviors at scale. Actually, many of them are not small pilots. They're big, large-scale programs. But also that really large-scale change, especially for the most vulnerable, will really require sort of coupled programs that address some of the structural drivers as well. A lot of people don't have choices because their resources are too limited. So the food literacy or nutrition literacy is hard for them to, obviously to act on. And the structural challenges are not just money, they're also time, they're also gendered relationships, etc. I'm hoping to do some more research on this in coming years. So, very grateful that you're asking those questions here, getting ideas in my head. Thank you.
Thank you, Dr. Partha. Thank you, Dr. Menon. In fact, we at the Center for Gender Studies do have some research on nutrition literacy, and we also call it behavioral change communication, and how kind of gender is interlinked. And we would do some more work, and we will have an exclusive webinar on the gender interactions with nutrition, and I hope to have you again for that webinar and continue the discussion. I see that we have no other question as such. There are again a bunch of statements. Great, excellent session. And there is one comment that about the CSR fund that is going towards COVID-19, and there are a few CSR organizations which are working on nutrition. The person is asking, why can't governments think about this? So CSR organizations on nutrition. So is there any reflection on that from anyone in the panel? It's not a specific question, but anyone can answer. That's what it says.
Sorry, CSR as in corporate social responsibility.
Corporate social responsibility. It's asked by Mr. Viresh M.
Okay. Yeah, I think that there isn't, again, much evidence on those things. I think those of us who work on issues related to nutrition and the industry would actually like to see, especially the food industry, reduce some of the damaging things they're doing for nutrition and not try to, as one of my colleagues called it, nutrition wash their bad marketing of bad products to us through some small-scale CSR projects. But I think there are many other industries that are not food industries that have the opportunity to make some contributions to their local communities through CSR. There are people who are monitoring or sort of tracking those, but I just don't think there's been a lot of evidence generation on how well those have worked. and what kinds of things in nutrition-related CSR has worked. So I think, again, an area for research for those who are interested in some of those, private sector linked efforts to tackle nutrition. Thank you.
Thank you, Dr. Menon. So if we don't have any other question, not in the chat box, there is no other hands raised, and we have also come
Dr.
to
Anita Brandon is raising a hand.
Let me see.
She's on the video asking to
Okay. I'll just unmute.
May I speak?
Yes, please.
Yes, I also am intrigued and would like to throw it to the panelists today to also enlighten us about the linkages that SDG Goal 2 has with SDG Goal 5, the gender equality goal and empowering women and girls, and the Goal 12, which is about responsible consumption and production. Because I think there are implications of the problem of hunger also because of the vulnerable situation of women in terms of how gender stereotypes are perpetuated, especially in countries like India, where an ideal good woman would be one who would feed the household and eat at the last. So she eats residual food, she eats what is left, though she might be expending her energy all the day long, working 14 to 16 hours a day on various activities, both household and outside in agriculture or construction. That's one. Then again, the gender stereotype of the beauty myth, where women undergo crash diets and starve themselves to stay fit and slim and conform to a particular vital statistics. So that also is a facet of hunger and starvation. And then there is this whole social milieu and cultural milieu in India where in weddings and on social occasions and functions, there is any amount of wastage of food. There are 50, like we call it in Hindi, chappan bhog. There are many kinds of varieties of cuisines in wedding feasts and social feasts. And most of that food goes to waste, whereas so many people are going hungry. So I think there has to be a convergence in thinking through and coming up with evidence-based policy on how to work forward on integrating Goal 2, Goal 5, and Goal 12. That is my food for thought for all of us. Thank you.
Thank you, Dr. Brandon. Any panelist wants to add anything to that, please feel free to do so.
Well, it raises a lot of interesting issues today and important ones, but I don't know if at 5:30 you want to get into this.
Right.
5:40.
Of course, we have exclusive sessions and more webinars coming up on specifically these kinds of interactions and these interlinkages between SDG goals. And we will have more discussions to go. And I see it's well past 5:30. And anytime the WebEx meeting will automatically stop. So before that happens, let me thank all the panelists here who have been here with us for the entire time, and what an excellent, energetic panel we had. So much of interaction, so much of knowledge, and hopefully we have had some first-hand evidence, some of the results that have not yet been published. We have got to hear that, and hopefully when they are published, we will read them. And of course, we'll create a repository of all the things that we are getting to learn. I will share it with you through this roundtable, the email list that we have, the mailing list that we have. And those of you who want to join the mailing list of Roundtable, please do send me a message or connect me in any way. We will connect you to the mailing list of Roundtable. So with that, I thank the panelists, Professor Vikas Rawal, Dr. Purnima Menon, Dr. Giacomo Zanello, and I hope that we will have you again in our future panels, in our future discussions on different issues. And I will, of course, come back to you with these discussions and try to kind of bring it forward. We are very interested in going forward with this. We're conducting more research, understanding the scenarios, and kind of informing our trainings, our programs, our capacity building activities that we do, and also to take up more research on this and have better data, better understanding. So we would continue this discussion and come back to you with more of such initiatives in the future. And to all our attendees, our audience, those who are here patiently interacting, we are really thankful to you. You are the one who are making the program happen. You are the one who is kind of making it enjoyable and interactive. And hopefully you will be here with us. We will have our next program again, and we will come back to you with the date and all the details. And with that, thank you and good evening.
Thank you very much for having us.
Thank you. Bye.
Thank you very much. Bye-bye.
Others may call them nutrition literacy and nutrition awareness, but I think what we've learned is that we can have change. They can improve nutrition behaviors at scale. Actually, many of them are not small pilots; they are big, large-scale programs. But also that really large-scale change, especially for the most vulnerable, will really require sort of coupled programs that address some of the structural drivers as well. A lot of people don't have choices because their resources are too limited. So the food literacy or nutrition literacy is hard for them to, obviously to act on. And the structural challenges are not just money, they're also time, they're also gendered relationships, etc. I'm hoping to do some more research on this in coming years. So, very grateful that you're asking those questions here, getting ideas in my head. Thank you.
Thank you, Dr. Partha. Thank you, Dr. Menon. In fact, we at the Center for Gender Studies do have some research on nutrition literacy, and we also call it behavioral change communication and how kind of gender is interlinked. And I mean, we would do some more work, and we will have an exclusive webinar on the gender interactions with nutrition, and I hope to have you again for that webinar and continue the discussion. I see that we have no other question as such. There are again a bunch of statements. Great, excellent session. And there is one comment that about the CSR fund that is going towards COVID-19, and there are a few CSR organizations which are working on nutrition. The person is asking, why can't governments think about this? So CSR organizations on nutrition. So is there any reflection on that from anyone in the panel? It's not a specific question, but anyone can answer. That's what it says.
Sorry, CSR is in corporate social responsibility.
Corporate social responsibility. It's asked by Mr. Viresh M.
Okay. Yeah, I think that there isn't, again, much evidence on those things. I think those of us who work on issues related to nutrition and the industry would actually like to see, especially the food industry, reduce some of the damaging things they're doing for nutrition and not try to, as one of my colleagues called it, nutrition wash their bad marketing of bad products to us through some small-scale CSR projects. But I think there are many other industries that are not food industries that have the opportunity to make some contributions to their local communities through CSR. There are people who are monitoring or sort of tracking those, but I just don't think there's been a lot of evidence generation on how well those have worked and what kinds of things in nutrition-related CSR has worked. So I think, again, an area for research for those who are interested in some of those, private sector linked efforts to tackle nutrition. Thank you.
Thank you, Dr. Menon. So if we don't have any other question, not in the chat box, there is no other hands raised, and we have also come
Dr.
to
Anita Brandon is raising a hand.
Let me see.
She's on the video asking to.
Okay. I'll just unmute.
May I speak?
Yes, please.
Yes, I also am intrigued and would like to throw it to the panelists today to also enlighten us about the linkages that SDG Goal 2 has with SDG Goal 5, the gender equality goal and empowering women and girls, and the Goal 12, which is about responsible consumption and production. Because I think there are implications of the problem of hunger also because of the vulnerable situation of women in terms of how gender stereotypes are perpetuated, especially in countries like India, where an ideal good woman would be one who would feed the household and eat at the last. So she eats residual food, she eats what is left, though she might be expending her energy all the day long, working 14 to 16 hours a day on various activities, both household and outside in agriculture or construction. That's one. Then again, the gender stereotype of the beauty myth, where women undergo crash diets and starve themselves to stay fit and slim and conform to a particular vital statistics. So that also is a facet of hunger and starvation. And then there is this whole social milieu and cultural milieu in India, where in weddings and on social occasions and functions, there is any amount of wastage of food. There are 50, like we call it in Hindi, chappan bhog. There are many kinds of varieties of cuisines in wedding feasts and social feasts, and most of that food goes to waste, whereas so many people are going hungry. So I think there has to be a convergence in thinking through and coming up with evidence-based policy on how to work forward on integrating goal 2, goal 5, and goal 12. That is my food for thought for all of us. Thank you.
Thank you, Dr. Brandon. Any panelist wants to add anything to that, please feel free to do so.
Well, it raises a lot of interesting issues today and important ones, but I don't know if at 5:30 you want to get into this.
Right.
5:40.
Of course, we have exclusive sessions and more webinars coming up on specifically these kinds of interactions and these interlinkages between SDG goals. And we will have more discussions to go. And I see it's well past 5:30, and anytime the WebEx meeting will automatically stop. So before that happens, let me thank all the panelists here who have been here with us for the entire time, and what an excellent, energetic panel we had. So much of interaction, so much of knowledge, and hopefully we have had some first-hand evidence, some of the results that have not yet been published. We have got to hear that, and hopefully when they are published, we will read them. And of course, we'll create a repository of all the things that we are getting to learn. I will share it with you through this roundtable, the email list that we have, the mailing list that we have. And those of you who want to join the mailing list of Roundtable, please do send me a message or connect me in any way. We will connect you to the mailing list of Roundtable. So with that, I thank the panelists, Professor Vikas Rawal, Dr. Purnima Menon, Dr. Giacomo Zanello, and I hope that we will have you again in our future panels, in our future discussions on different issues. And I will, of course, come back to you with these discussions and try to kind of bring it forward. We are very interested in going forward with this. We're conducting more research, understanding the scenarios, and kind of informing our trainings, our programs, our capacity building activities that we do, and also to take up more research on this and have better data, better understanding. So we would continue this discussion and come back to you with more of such initiatives in the future. And to all our attendees, our audience, those who are here patiently interacting, we are really thankful to you. You are the one who are making the program happen. You are the one who is kind of making it enjoyable and interactive. And hopefully you will be here with us. We will have our next program again, and we will come back to you with the date and all the details. And with that, thank you and good evening.
Thank you very much for having us.